Half a day, Lillian. Thanks for doing this. Appreciate it. I just wanted to ask you, first of all, Senator Amanda Shelton had sent out a news release regarding a change in the federal PPP, the Paycheck Protection Program. And she had mentioned that hospitals are now included in that, and that there's a possibility that perhaps the hospital's payroll could be covered under this federal program. Have you looked into that, and what is your reaction?
Yeah, I'm reading it, the copy that you sent to me. My reaction is that, wow, and it's great. But however, my understanding from reading it is that there is a clause. This is a loan. So, it's a loan that I'm sure we're going to have to repay. So that's my concern. The other one is that there is a clause that says shall not be rendered ineligible for the PPP loan due to ownership by a state or local government if the hospital receives less than 50% of its funding from state or local government sources. If the hospital gets reimbursed from Medicare, Medicaid, and MIP. So those are three government sources of reimbursement. And the combination of the three, we get more than 50%. So I'm not sure that we will then be eligible for this. There is another statement that says exclusive of Medicaid. So maybe with that statement at the end of that sentence, exclusive of Medicaid, so with Medicare, MIP, maybe we might be able to be eligible for this reimbursement for payroll costs. The only thing, again, is it's a loan. It's not an additional funding that, we're not going to have to repay.
Yeah.
So,
Lillian, if it's similar to what the PPP is for private businesses, at a certain point, if you expend a certain amount of money, then it becomes a loan that you don't have to pay back. So in effect, it becomes a grant. And I'm not sure if that might apply to the hospital as well. It seems like it should, because that's what they're doing for private businesses. But are you having someone look into this for you at the hospital from your staff?
Our CFO, our acting chief financial officer, Yuka, is looking into it. We just got this today. And so I haven't had a chance to really do a deep dive into it, but we will, since it is an opportunity for revenue for us to be reimbursed in terms of our payroll costs. We're banking on the FEMA funding because that's normally what we get reimbursed for whenever we have a disaster. And so, this is an additional funding source for us, which is great. But we want to make sure that, we're clear with it, that, our eligibility is there. And if there is no repayment, then certainly, it will be to our advantage.
Just to get an idea of how much you might be able to save, how much is your average payroll?
Our average payroll is 1.9 every 2 weeks.
Okay.
Yeah.
So that's almost 4 million a month, yeah?
Mm-hmm. Correct.
Okay. Yeah. So how's things going there at the hospital? How are your nurses? I know that the hospital, the doctors and nurses are working extra hard because of the situation. What's the morale like? What's the status?
When I walk around and I talk to the nurses and I talk to the doctors, the morale, I think, at first we were very anxious, all of us, because this is such an unknown, condition, the COVID, it's all new to us. So we thought we were prepared, but when usually when you think you're prepared, but then when it happens, it's like, oh, okay. You learn along the way, things that need to be, fine-tuned. But as far as the PPE, we were able to have our PPE supplies, which helps our staff, our nurses, especially who are the front lines, who have the direct interaction and contact with the patients or the individuals that come in as PUI. They're all protected. So we're making sure that, we have the PPEs for them to prevent them getting the transmission of the disease, because we want to make sure we preserve our healthcare workers. And so for the most part, of the 155 employees that were tested because of the exposure, not a whole lot of them came back as positive with positive results. So, it's a small percentage, which says a lot because then, the employees are making sure that they protect themselves. They follow the infection control measures that we have instituted. And so the morale, for the most part, I understand the staff are happy despite the anxiety, despite the concerns and the fears, because they're worried that they may catch the infection. So, but for the most part, the nurses and the doctors are happy, and that it's been many weeks since we've gone through this, and so many lessons I've learned. But I think now that we have our processes in place, our protocols and our policies are in place, and people are putting it into effect, there's some comfort level that, okay, we've gone through this, we can do this, we feel comfortable. Now that we have a little bit more experience and knowledge about this disease and we have the process in place, it's helped a lot. Our census has gone down. COVID positive patients has gone down.
I understand that the hospitalizations have gone down, and in fact, the SNU has been kind of mothballed for now because there's no patients.
We put it on a stand down. Yeah, we put it on a stand down right now, temporary, because there are no patients there. But we are keeping it ready. It's mission ready, so that if in the event we do have a surge, an influx of patients that need them to be admitted and isolated, then it's ready.
Yeah. Are there any nurses that are being assigned to GMH nurses being assigned to GRMC at this point?
We do have some nurses who work both facilities. So, some of them have that ability to continue working part-time there or full-time there and part-time here. So we're sharing resources, especially given that we are limited with nurses on this island. So we're sharing the resources.
Okay, but when they work at GRMC, they're being paid by GRMC, right?
Absolutely, because they are employees of GRMC. Whether it's full-time or part-time, they are employees there.
And one other thing, so we got a letter from the husband of a nurse who was saying that I don't know if they're married, but his partner, she was one of the initial nurses that were responding to the virus situation, and that she, on her own, stayed at a hotel room so as not to infect her family, and that she was seeking reimbursement but was denied. Is that the case? Are you familiar with that?
I'm not going to deny it. It is true. I denied the request, partly because there was no supporting documents. There's no other information what she expended. I mean, okay, if you're requesting something, provide your supporting documents to authenticate and to really justify that you were at that hotel. I don't know. I mean, perhaps you were somewhere else. I don't know that. And so, yes, the truth is I denied her request. But as I mentioned this morning at Patty Royo's talk show, that I'm open for reconsideration if the nurse herself provides the supporting documents that are authenticated from the hotel that she stayed. I need to see that.
Okay. So she had like a debit card or a credit card.
I don't know what she is because it wasn't in the letter. And again, it was only her who requested. There are several nurses who had longer hours of exposure to COVID patients or PUI. They work 8 hours, 12 hours, but I did not receive any other request for reimbursement. It's just this one individual nurse without any supporting documents.
All right. Anything else you want to add at this point, Lillian?
No, but we still need to maintain the awareness and the practices that have been put into place as far as social distancing, wearing a mask, and not washing your hands. We need to continue that because although we are at a flattening level in terms of the census and the exposure and the positive cases, we don't know. There might be a surge of cases, and so we just have to continue to be prepared. The other message I like to send out is I know that some of the patients who are not COVID patients but have chronic medical conditions, I'd like for them I encourage them to reach out to their doctors, continue the care and the management and the treatment of their chronic medical conditions so that they don't end up coming up into the hospital, whether here or GRMC, with more serious condition because of their chronic medical situation. You know, they need to manage and to need to take care of that and be followed up, especially if they're running out of the medications or they ran out, you know, continue, because we're seeing now an uptick of those individuals who have chronic medical conditions but are not PUIs and are not COVID cases. We're seeing that. Our numbers are increasing.
Oh, wow. Okay. All right. Well, thank you very much. I appreciate your time. I know you've been very busy. Thanks to you so much, Lillian.
All right. Thank
Okay.
you.
Take care. Stay safe.
Bye-bye. You too.
Thanks, Jason.